This is Dr. Bresnitz. I mentioned earlier that the vaccine is allocated from the federal government on a prorated basis on populations to the state, which, I think is the fairest way for this to do that. Otherwise, the governors would be arguing with each other and fighting about who got more or less. But how is the vaccine, how are the doses allocated to the counties in the state? Is it also on a prorated population basis, or is there some other algorithm?
Well, first of all, I'm going to just push back gently on that, the way that you supported the population allocation to the states. So now that this 1A category has been so expanded to include
Mm-hmm.
people 65 and older, Pennsylvania is one of the oldest states in the United States. The average age in Pennsylvania is, I think, the second oldest in the country. And so I have been pushing and have raised this with our federal delegation to push that now that 1A has been expanded in this way, the vaccine should be allocated based on population demographics, not just population. Because if we here in Pennsylvania don't get more doses based on how many people we have in this state that are 65 and older, the states around us are going to be to 1B when we're still halfway through 1A. And I just don't think that that's fair or equitable. When it comes to how does Montgomery County get our allocation, I have been trying to get clarity on that from PADOH, and I do not yet have the details of how those decisions are being made. I've been told that I will get to see them. They're being revisited. I have made the same argument that now that we have this expanded 1A, that PADOH should be looking at the census population of people 65 and older as a starting point for how they allocate vaccine across our counties. Because I can guarantee you that Montgomery County, we have the second most licensed long-term care facilities of any county in the Commonwealth. So I can guarantee you that we have proportionately more people that are 65 years of age and older. And I think we need to get more doses based on that. Or again, it is going to be months before we get to our teachers and our bus drivers and our grocery store clerks. And I don't think that's fair. So I am working really hard to get as many doses into this county as I can based on the data of people who live in this county.
But
You can
Arkoosh,
tell I'm very passionate about this issue, and I'm sorry.
Well,
But I just think it's horribly unfair what has happened to our state and to our county.